Does your life completely derail the week before your period? I'm not talking about minor cravings or being a little tired. I'm talking about physical pain and emotional shifts so severe that you cancel plans, snap at your loved ones, or literally cannot function at work. For years, women experiencing this have been brushed off and told they just need to deal with it. But medical research tells us a completely different story. You might actually be part of the 2 to 5% of women suffering from a depressive condition called PMDD. There is a massive medical difference between having normal pre-period symptoms, actual PMS, and PMDD, but most doctors never explain the exact criteria that separates them. In fact, if your symptoms don't meet one specific requirement, which we're going to cover today, you technically don't have PMS at all. In this video, we're breaking down exactly what your symptoms mean, the critical rules that separate these two conditions, and the exact diagnostic checklist you need to finally get the right treatment. Let's get straight to the biggest secret that doctors use to diagnose premenstrual conditions. The fact that it's completely normal to experience changes before your period. Up to 90% of women will notice mild breast tenderness, slight bloating, or minor mood changes. But here is the critical distinction. Normal symptoms do not interfere with your daily life, so you can still work, socialize, and function normally. Let's look at an example. Let's meet Lisa. A day or two before her period, Lisa's breasts feel a bit tender and she's more tired than usual. She mentions it to her partner, but she still goes to work, hits the gym, and keeps her social plans. She changes absolutely nothing about her routine. This is perfectly normal. It does not meet the criteria for PMS, and no treatment is needed. But what happens when those symptoms do force you to change your routine? In just a minute, I'm going to share 3 specific scenarios. One of them might sound like exactly what you go through every month, and it reveals the exact formula that separates regular PMS from something much more serious. What is actual PMS? So if Lisa doesn't have PMS, who does? Premenstrual syndrome, or PMS, affects about 20 to 25% of women, and the absolute key difference between normal and PMS comes down to one word: interference. To have PMS, your symptoms must interfere with your daily functioning. You need at least one emotional or physical symptom during the 5 days before your period in at least 2 menstrual cycles, and these symptoms must disrupt your normal activities. So let's take a look at Sarah. About a week before her period, Sarah gets significant breast tenderness and bloating. It's so uncomfortable that she skips her favorite yoga class, avoids tight clothes, and feels highly self-conscious giving presentations at work. Even though her symptoms are purely physical, they affect her choices. This is PMS. Now let's take a look at Maria. Maria doesn't have physical symptoms at all, but for several days before her period, she feels incredibly irritable. She snaps at her kids over tiny things and completely avoids social gatherings because she just doesn't feel like herself. This is also PMS. She has emotional symptoms only, but they actively damage her relationships and social life. Now, Sarah and Maria both have PMS. But what happens when you have both physical and emotional symptoms hitting you like a freight train? Coming up, I'm going to reveal the 5 symptom rule that elevates this from PMS to the most severe form of premenstrual conditions: Premenstrual Dysphoric Disorder, or PMDD. This affects roughly 2 to 5% of women. Remember Maria and Sarah? They only needed one symptom to be diagnosed with PMS. But a diagnosis of PMDD requires a total of at least 5 symptoms. And here's the catch: you must have at least one emotional and at least one physical symptom. You cannot have PMDD with only physical or only emotional symptoms. Let's take a look at Jennifer. Before her period, Jennifer gets severe mood swings, intense anxiety, and feels completely overwhelmed. These are 3 emotional symptoms. She also gets extreme fatigue, bloating, and breast tenderness. That's 3 physical symptoms. And that's 6 symptoms total, and they are so severe that Jennifer calls in sick to work, cancels plans with her friends, and ends up in fights with her partner. Because she has more than 5 symptoms, a mix of both physical and emotional, and they significantly disrupt her life. Jennifer has PMDD. If Jennifer's story sounds familiar, you might be asking yourself, is this my fault? Is there something wrong with my body? In about 30 seconds, I'm going to debunk the most toxic myth doctors hear about PMS and PMDD and give you the real biology behind why you feel this way. Let's bust some myths because the amount of misinformation out there is staggering. Myth number 1, you're just making it up, or it's just hormones and you need to deal with it. PMS and PMDD are real biological medical conditions. They are not character flaws or signs of weakness. Research shows these conditions happen because of how your brain responds to normal hormone changes during your menstrual cycle. It's specifically a brain chemical called serotonin, which affects your mood and a sensitivity to progesterone metabolites. Myth number 2, all women get PMS, so it doesn't need treatment. As we covered, 90% of women get some form of symptoms, but only 20 to 25% have PMS and only 2 to 5% have PMDD. If your symptoms interfere with your daily activities, it is not normal and you deserve treatment. Myth number 3, if you have mood symptoms before your period, you must just have general depression or anxiety. No. The secret here is timing. PMS and PMDD symptoms only occur in the week or 2 before your period, and they generally improve once your period actually starts. General depression and anxiety disorders happen throughout the entire month, but may get exacerbated during the luteal phase. Myth number 4, PMDD is just severe PMS. No. While it is more severe, PMDD is a completely distinct diagnosis. It is actually classified as a depressive disorder, and because it requires both physical and emotional symptoms, it often requires different treatment approaches than PMS. Myth number 5 and 6. There's nothing you can do but wait it out, or you have to take daily medication for months to see results. This is entirely false. For PMDD, antidepressants called SSRIs, which stand for selective serotonin reuptake inhibitors, are the first-line treatment, and unlike treating general depression, SSRIs for PMDD often work incredibly fast. We're talking within days, not weeks. Because of this, some women only take their medication during the 2 weeks before their period, known as luteal phase dosing, instead of every single day. Myth number 7, PMS or PMDD means you can't get pregnant or your reproductive organs are broken. No. These conditions do not affect your fertility at all. They are related to your brain's response to hormones, not a problem with your ovaries or your uterus. So now you know the symptoms and you know these conditions are highly treatable. You should book an appointment with your doctor right away if your symptoms interfere with work or relationships, if you're avoiding activities, or especially if you ever feel hopeless or have really dark thoughts. But when you go to the doctor, they're going to ask you to do something very specific. They're going to ask you to track your symptoms daily for at least 2 menstrual cycles. You can use a diary or an app, but this tracking is essential. It helps with your diagnosis because it shows that your symptoms follow a cyclical pattern happening before your period and improving afterwards. Many women often think their symptoms are premenstrual, only to realize through tracking that they actually occur all month long. Once diagnosed, you have treatment options. If you have PMS, your doctor might recommend regular exercise, stress management, getting adequate sleep, or cognitive behavioral therapy, CBT. They may also suggest certain birth control pills or SSRIs if your symptoms are moderate to severe. And if you have PMDD, the first-line treatment typically is an SSRI, but they may also use CBT-specific birth control pills, especially those containing drospirenone, and in very severe cases that don't respond to anything else, hormonal medications may be suggested. The bottom line is this: Not all premenstrual symptoms require treatment. If your symptoms are mild and you can still live your normal life, that is just your body doing its thing. But PMS and PMDD are real treatable medical conditions. You do not have to suffer through them every single month. If your quality of life is taking a hit, talk to your healthcare provider. With the right diagnosis, most women see massive improvements. But what if your main symptom is just being unbelievably, overwhelmingly exhausted? Click the video on your screen right now to find out whether extreme fatigue before your period is normal or a sign of something else. I'll see you over there.